We begin with the latest attempt to convince Americans that healthcare reform is really just a big secret plot to kill old people. MSNBC's own Pat Buchanan making that case in a column published today. And now the conservative organization Club for Growth has launched a nationwide ad campaign to try to mainstream the idea that reforming healthcare is a secret plot to kill your grandparents.
Tell your members of Congress to oppose government-run health care.
Like Medicare. For the record, what's being proposed in Washington is not government-run health care. And for the record, the healthcare reform is a secret plot to kill old people conspiracy theory is based on the fact that health legislation being debated now would cover living wills. So if you wanted a living will, the process of getting one would be covered. That provision was introduced into the healthcare debate by Republicans, including Senator Johnny Isakson of Georgia. And having a living will where you say how it is you'd like decisions to be handled at the end of your life, where you make your own decisions about that ahead of time, that is something the federal government has formally encouraged by legislation for at least 20 years, without controversy. But politically, the facts don't really matter, right? Not if they can be distorted to scare people, particularly if they can be distorted to scare old people. What's becoming clear now is that there's a connection between the two big things that we have observed recently about the healthcare fight. On the one hand are these crazy, disprovable, but nevertheless endlessly stoked conspiracy theories. That healthcare reform is communism, that it's a secret plot to kill your grandpa, that it's a government takeover, it's something called Obamacare. It's going to mandate abortions, it's going to mandate sex change operations. I would make up something that could be the next crazy thing, but everything I could think of that is that crazy has already been actually used by these people. There's these crazy conspiracy theories about healthcare reform on the one hand. And on the other hand, there are these organized efforts to shut down political debate about healthcare by using angry crowds to take over town hall meetings and chase congressmen through parking lots. These two observable facts about the anti-healthcare reform forces, it turns out are really one big thing. Do yourself a favor if you have a moment and you're online and go to the website recessrally.com. It's a very nice website. It's very slick. It's got a big stop sign right there in the middle above the list of all the town hall. We the people. That's how the Republican Party has been describing these town hall takeovers, too, putting out a statement today saying that Democrats should stop being so upset about them. Quote, what Democrats call mob rule, the average American calls democracy. These kinds of despicable characterizations of middle-class Americans smacks of elitism. So the Republican Party says the town hall takeovers, the bullying, and the intimidation we've been seeing, these are just average middle-class Americans spontaneously expressing their feelings. Conveniently, the average middle-class Americans bringing you recessrally.com are actually listed at the bottom of that website. If you scroll down to the bottom of the page, you can see their national coalition of sponsors. As you can see, it's okay. There's like Michelle Malkin. She's one of the people on Fox News. There's Smart Girl Politics. That actually sounds very nice. Red State, a fairly prominent right-wing blog. Okay, so those are sort of recognizable or at least of interest. But who are all these other groups? Here's one called American Majority. You know, the average middle-class Americans behind American Majority include the organization's president, Ned Ryan. He's a former speechwriter for President George W. Bush. The executive director of American Majority's Minnesota office, coinkydink, regional field director for Bush Cheney 04. Executive director of their Kansas office would be a former Republican state legislator. Executive director of their Oklahoma office, a former Washington, D.C. conservative lobbyist. You know, just your average middle-class Americans. These guys are the pros. This is an industry. Americans are showing up at these events to shout down the discussion and to chase their congressmen, and they are enraged. And they're enraged, at least in part, because they're being riled up by over-the-top, fabricated conspiracy theories about health care. And they're being directed and orchestrated by the corporate interests that do this for a living and do it very well. RecessRally.com is not some organic outgrowth of American anger. This is how corporate America creates the illusion of a grassroots movement to support their own interests. This is what they do. They are professionals. This is an industry. To talk about these town hall events as some organic outpouring of average American folks who have concerns about health care is to be willfully blind as to what is really going on, which is professional PR operatives generating exploitative, manufactured, strategically deployed outrage in order to line their own pockets. These PR spinmeisters get paid a lot of money for doing it. The corporations they work for get to kill legislation that would hurt their profits. And the real people who they launch into these town hall settings after they're told that healthcare reform's a secret commie plot to kill old people and to mandate sex changes, those real people get more and more and more and more angry and more and more and more alienated. And ultimately they get left like the rest of us, with a healthcare system that is broken and doesn't work in the interest of the American people, but does work in the interest of the corporations that profit from the way the system is now. This is professional, corporate-funded, Republican-staffed PR, and it should be reported as such.
Why do you continue to support a Nazi policy, as Obama has expressly supported this policy? Why are you supporting it?
Let me, but I will...
A real solution.
When you ask me that question, I am going to revert to my ethnic heritage and ask to your question with a question. On what planet do you spend most of your time?